Okay, good evening, everyone. Welcome to our webinar, Mass Peace Action, third webinar in the series, Fund Healthcare, Not Warfare. And this is State Legislators Respond to the Coronavirus Crisis. Across the nation, millions of healthcare workers are under great stress and direct danger, desperately in need of increased resources, investment, and income. Hundreds of articles, interviews, webinars, and broadcasts call attention to the nation's failure to properly invest in healthcare and in public health systems, but silence on the diversion of trillions of taxpayer dollars to the military continues. A coalition of organizations, including Mass Peace Action, Massachusetts Poor People's Campaign, Our Revolution Massachusetts, Progressive Democrats of America, and Cambridge Residents Alliance, is developing a campaign whose focus is Fund Healthcare, Not Warfare. Directed to our congressional representatives, we call for more federal spending on healthcare, including Medicare for All, financed in part by cutting hundreds of billions from the bloated Pentagon and nuclear weapons budgets. To help circulate the message that we have an online petition that we urge you all to sign, my apologies. And it's at masspeaceaction.org, and I think Cole will be circulating that. So tonight, really in this series, I think it's the third of this series, right, Jonathan and Cole? Yes, we're really continuing in this theme of funding healthcare and not warfare. And now we're going to hear from local legislators about how they're responding and the things that they're doing to really help people in Massachusetts to cope with this health pandemic that is taking over the country and the world. And so we're going to have now a kind of report from the state legislature. And we have four real progressive champions here with us tonight. And they are Representative Nika Elugardo, and she's from the 15th Suffolk and Norfolk District. Representative Lindsay Sabadosa from the 1st Hampshire District, Representative Mike Connolly from the 26th Middlesex District, and State Senator Jamie Eldridge, who is from the Middlesex and Worcester District. And thank you all so very much for being here tonight and for all that you're doing. We're deeply grateful to you and for your presence here tonight. And we look forward to hearing from you. What we're hoping for is that each one of you could speak for about 3 or 4 minutes about what you're working on. We will have time then for perhaps a more free-flowing conversation. And then we'll start to have questions coming in from the people who are on the call tonight. And we're hoping that we can trade off whichever one of you is appropriate to answer the question. So thank you again, and we can get started. And we're hoping that Representative Elugardo will kick us off. And Nika, we'd love to hear from you and elaborate on your wonderful talk that you had given to us at the annual meeting of Mass Peace Action.
Hi, everyone. Thanks for having me, and hello to my colleagues. It's fun to see you, see your faces. And it's an honor to be considered part of this group. And, it's really special to me to have you continuing to champion one of the most important elements of policy, which is our work around peace and warfare and the diversion of spending there instead of a much needed, not only domestic, not just that it's domestic, but sort of human rights needs here and around the world. And the egregiousness of it and what it says about our values and what it says about our collective soul and morality as a nation. And so I'm just grateful that there's such a strong group that continues not only to advocate with sort of policy ideas, but with real data and facts, and that's continually equipping us to be able to understand what's going on at the federal level and at the state level. So thank you for that, and for just keeping me in the family and growing me as a new legislator. I appreciate that. There is a lot going on at the state legislature, sort of in the way that when you have a harvest season, it starts with planting a lot of seeds, and the seeds are they're still basically under the ground, but there's a lot that's been planted. And I feel hopeful because we have about 100 bills circulating through that are COVID response and recovery related. I've co-sponsored about 70, 75 of those. And that's because they're mostly very progressive bills. As we discussed last time, everything from what we're trying to do with wages and employment and bringing justice there so that every single essential worker who is working right now has hazard pay, has significant sick leave and sufficient sick leave and other things that they need, to cash assistance that's not just one time, but that's going to be ongoing and recovery oriented, not only for the people who are in deep poverty, but for everyone who needs it, making sure that the small businesses and nonprofits who are receiving assistance include the ones that are led by people of color, by women, by low-income entrepreneurs who are sort of up and coming in their business work, and everything that we already know. So I'll just close by saying, because I want to leave lots of time for my colleagues and for questions, by saying that we know, everyone on this call knows, that COVID hasn't created injustices. It has revealed them. It's revealed major cracks in the foundation of our democracy, in the foundation of our economy, and the foundation of our just conception of justice in the United States, and really more broadly than us, but certainly here. And it's applied pressure to those cracks, and they're expanding and they're breaking. And because of that, we have a unique opportunity, which sadly will not remain unique. I think this is going to be a cyclical reality for us, from severe weather events to ongoing viruses and things of that nature, and other kind of cataclysmic events that are driven by the combination of our poor stewardship of the planet and our unwillingness to set up the systems that will help us to take care of every person who's living here in the United States. So we have a lot of work before us, not only to get through the COVID crisis, but to make sure that we're launching with the stories that we have here that have, like so many other things, crept into the middle class and beyond, so that more people are listening to these stories because more people are feeling the pain. And we're going to be relying on each other here and in our networks beyond here to make sure that we extend over the next decades, really, those stories into our policymaking, into our advocacy, into our listening, and into not only what we do in terms of policy thinking, but who we bring into the process of making our laws.
Thank you so much, Nika. I think, Lindsay, would you mind going next? Representative Sabadosa?
Lindsay is fine, thank you.
Okay.
Certainly. Thank you, everyone, for having me here this evening. I could just say I second everything that Rep. Elugardo said, and be done, because really I think the key statement is this has really accentuated all of the cracks that we knew were there. But I think people are, if you weren't the one suffering before, you're kind of realizing now that things were not as great as we thought. There was this facade that some people were doing okay, and so the status quo could be all right, and so so long as what's happening in my backyard is fine, we'll be okay. And I think that that's falling down for a lot of people. Particularly, it would be remiss if I didn't talk about healthcare, because it's one of the things that I care the most about. We're getting calls in our district every single day from businesses that don't know how they're going to continue to afford paying premiums so that their workers can remain covered. We're getting people who don't think that they're going to be able to afford their own premiums because they were previously self-employed, and so they're talking about going onto the state system. And yet we have people who previously qualified for Mass Health and are now getting kicked off Mass Health because the government sent them an extra $600 check along with their unemployment, which led them to make too much money to qualify for Mass Health, even though that check is going to end in 2 months. So the number of people who are realizing the level of absurdity in the way that we provide healthcare is increasing by leaps and bounds. And I do think that means this is a moment that we have to seize. Now, we started off this call rightly talking about our military budget, and we know that on the federal level, there are a lot of people who are going to push back against that and are going to say, nope, we can't afford it. We have to keep spending as is. But I'm hoping that this is the moment where people, regular people with their stories, start to rise up and push back and refute that narrative that these things are too expensive and that we can't have them. You know, COVID, I was on a town hall a few weeks ago around Earth Day. I guess it wasn't even a few weeks ago, but time feels both short and long right now as we're in quarantine. And we were talking about why COVID is also an environmental justice issue, which connects to healthcare as well, because we're seeing the communities that are hardest hit by COVID are also the communities that suffer from the highest asthma rates. And they suffer from the highest asthma rates because they also suffer from pollution, because people have been putting brownfields and biomass plants and whatever that might be into these communities. And so that cyclicalness ties together in really powerful ways. And I am hopeful again that we will talk about that, not only in groups like this, where we've known that for a long time, but that we'll start to see that in our newspapers and on the floors of the State House as we're debating policy, to make this more of a reality for folks and to really drive home the time to act is now. The last thing that I will say, because I know that 3 to 4 minutes go quickly, is one of the things that for me COVID has really emphasized, and I knew it before, but again, the cracks, is the way that we treat people who are incarcerated versus the way we treat people in other congregate living situations. The statements that I have heard people make where they say, but they deserve that because they're incarcerated, are kind of appalling when we're talking about the spread of a highly infectious disease. No where they could potentially get a disease that could turn a sentence into a death sentence. We don't have the death penalty in Massachusetts. Jack Lewis likes to say that a lot, and he's right. And so I'm focused really almost singularly in the last few days around the decarceration legislation that I filed, and I'm very grateful that Mass Peace Action has endorsed it along with about 50 other organizations across the state, because it's really time to break down that barrier. And this is, we keep saying, the time to break down barriers, but we also have to break down that barrier and understand that everybody deserves to be safe. Everybody deserves to have access to medical treatment, adequate medical treatment, not ibuprofen to treat COVID. And everybody deserves to feel safe and to be with their families if that's most appropriate. And so I guess I will close with that because I also want time for questions, but thank you again for having me here this evening.
Thank you so much, Lindsay. Mike, would you mind going next?
Absolutely, yeah. Well, thank
busy.
you. Yeah, thank you, Andrea. And it's such an honor and such a pleasure to be here with this group of progressive superheroes and colleagues and everyone from Mass Peace Action and everyone watching or participating at home. First and foremost, I would associate myself with everything that Nika and Lindsay said. You know, they've really captured it. And, you know, this is a moment where those cracks in our social safety net are being revealed. And of course, you know, that ties directly to the mission of Mass Peace Action, because it's the commitment that the United States has maintained to militarism and to other, you know, evils, frankly, that have made it impossible for us to address these cracks in our social safety net. And, you know, on the one hand, I can tell you we have made some progress in these past 7 or 8 weeks, but we have a long, long, long way to go. You know, when this COVID-19 emergency really started in Massachusetts, initially, you know, my great fear was that we were very close to seeing the complete collapse of the healthcare system in our state. And many of us, you know, sounded the alarm to call on Governor Baker to do things like issue the stay-at-home advisory and the shutting of non-essential businesses. And on the one hand, the governor's, you know, responded in certain ways, but at the same time, we need to be very clear that the response itself hasn't been adequate. You know, I can remember in mid-March, Massachusetts was at around 200 cases, you know, confirmed, recorded of COVID-19. Washington State was more in the ballpark of around 800 or 900 cases. 2 weeks later, Massachusetts had exceeded 10,000 cases. Washington State was still in the 7,000 case area. So the epidemic of this, coronavirus disease in Massachusetts has absolutely exploded. And, we can't accept that just because we haven't seen the complete collapse of our healthcare system, that we are in any way in a satisfactory position. And my fear is, maybe we have reached a plateau, according to certain numbers, but there are no guarantees that we're then going to, in a timely manner, see that plateau go downward and reach a sort of a normal state. So my fear at this point is that, we could be in for a long, hard plateau with far too much, disease and death. And of course, one of the main tragedies there is we know that it will be people of color, it will be people of lower incomes. We know that it will be the undocumented immigrant community. We know that people experiencing homelessness or people who are incarcerated are the ones who are going to die, frankly, because people like Donald Trump or even, Governor Baker haven't, taken enough urgent action more quickly. And so, this is, there's nothing that I can compare this to, or I think any of us can compare this to. We are literally in the fight of our lives. And, we have to do all we can to respond in real time. And then I think the second thing we have to do, and I shouldn't forget nursing homes, or, any sort of congregate living facility. But what we also have to do is, as we try to manage and deal and respond to this emergency, we have to take the lessons with us and allow us to draw on those lessons to transform our society. We have to get to a place where everyone has health care, Medicare for all, no questions asked. We have to get to a place where housing is guaranteed for all people. And there's so many other things that we have to do. So I look forward to continuing the conversation and really feel like it's, it's those of us in this conversation that have been offering the answers. So I'm hoping we can just continue supporting each other and hopefully making some real change in the weeks and months ahead.
Thank you so much, Mike. Jamie, would you like to say a few words?
Absolutely. Thank you so much. So thank you so much to Cole and Andrea and Mass Peace Action for having me on. Honored to be here with Nika and Mike and Lindsay. And we have literally directly worked on legislation that has passed so far during the pandemic. So I just really appreciate their leadership on so many issues in the House. I would say the brightest light so far that the legislature has taken action on is the eviction and foreclosure moratorium bill, which Mike led the effort on the House side, alongside Representative Kevin Honan. And I know that Lindsay and Nika were incredibly helpful in passing that bill, arguably the strongest in the nation. So I think that does show that the pandemic does create an opportunity to pass very progressive legislation. At the same token, I really want to emphasize that the corporate special interests are going to push back, just as much. I will say on the Senate side with that eviction moratorium bill is the landlords associations push back, and initially we're making some progress on gutting the bill on the Senate side. So, they are active, and so we need to all be active as well. And while I do agree that the pandemic creates an opportunity to pass progressive legislation, I am very concerned that a lot of people on Beacon Hill will just look at the pandemic as, well, we'll get through this sometime in the summer. Everything will be back to normal. And I think really that's why Mass Peace Action needs to really be vigilant. And I'll just list 3 areas beyond the housing issue is one, healthcare, which Lindsay and I co-chair the Medicare for All caucus. We've been having virtual town halls about that. Is this an opportunity to actually move towards making a healthcare right in Massachusetts? We've continued to have obstacles on that, so that's a real area where I think we could break through. On the prison issue, Lindsay already talked about, is a prisoner's life as valuable as anyone else who has COVID-19? Extremely concerning issue that I think we need to move towards passing Lindsay's prison decarceration bill. It's a fantastic bill. And then on the immigration or immigrant front, I have filed a bill with a couple of House members, the Immigrant Taxpayer Stimulus Act, to provide essentially the same stimulus check as the Federal CARES Act went to people who are eligible. Our immigrant communities are really suffering, including our undocumented immigrants. So what is the state can do? If we're an overwhelmingly Democratic legislature, we should be passing this legislation. The federal government can't. So thanks so much for having me on. Looking forward to the questions. Really honored to be with my House colleagues, and appreciate Mass Peace Action doing this tonight.
Thank you so much, Jamie. We're going to open it up to questions, so people could start typing their questions in. If you don't mind, I wonder if I could start with one to Mike, actually. And something that I'm sure people would be interested to know is what was a little bit of the backstory like when you were putting all of that pressure on the governor to issue stay-at-home orders? Because I was watching what was going on and wondering how that played out. What was it like, I guess, working with him, and was there resistance? Because what it sounds like you're saying is that we were slow to act. It sounds like, because when you were comparing us to Seattle and to Washington State, and how it seems like maybe we didn't act as quickly. What was the resistance? What was a little bit of what was going on behind the scenes, and what was it like working with him and to basically put pressure on him to make that stay-at-home order?
Sure, thanks for the question. I drafted a letter, and I believe all of our colleagues here, Reps Elugardo, Sabadosa, Senator Eldridge, all joined me in signing this letter, where we called on Governor Baker to issue a stay-at-home order almost immediately after the state of emergency was declared. And, there are some facts about the COVID-19 transmission, things that we were able to draw from what people in Italy were begging us to understand. The fact that, the incidence of this disease, it is so incredibly contagious that the number of people who have it can double every few days. So when you figure out that exponential logic, and you figure out how this disease preys on people who have pre-existing, conditions, you start to realize the necessity and the logic. And I think what we really tried to do was to get Governor Baker to appreciate that logic. And, I think he's made progress in it, but it's clear that, other states where the localized epidemic wasn't as severe, they took much stronger action. And to this day, the governor actually denies that he has the ability to order people to stay at home, which is, plainly false. There's something called the Massachusetts Civil Defense Act that was implemented in 1951, and it says that the governor will have any and all power over persons and property to do whatever is necessary or expedient to meet a state of emergency. So the governor literally, literally goes out and says, I don't have the power to do this. Also, just, picking on that language I just explained, I just outlined, it highlights the fact that we could have done and we should do so much better. For example, people experiencing homelessness. If the governor has all power over property to meet a state of emergency, that means he's literally empowered to just, say that hotel over here, this dorm room over here, that vacant property over there, we can make this space available for people who are unsheltered or for people who need a place to isolate. And so, to sum it up, I think that in the initial stages, especially, the mentality that we had from the highest levels of our government was sort of like this was a snowstorm or a hurricane that was approaching, that we couldn't really shape the severity of it, so we're just going to prepare to respond. And a tremendous amount of work has been done in terms of preparing that response. But I'm afraid, and I think certainly you can see by all the different tragedies that we have going on around us, not enough was done soon enough to really try to mitigate and limit the impact. And so, we have no choice but to continue. And of course, with Trump in the White House, we have to point out it's been nearly an impossible situation for so many leaders in state government because we're still so far behind in terms of deploying the sorts of testing capacity that so many other countries around the world have been able to deploy. And I'll wrap up by saying that ties back to the mission of Mass Peace Action, because here we are, we have the Blue Angels flying all over the United States, putting on shows for people, but we can't get the little cotton swabs you need to conduct these COVID-19 tests. So it's an absolute outrage and tragedy.
Thank you very much for that. Cole, do you want to start reading from the questions?
Sure. We have
Rosemary.
two people are asking about the situation in Bristol. Mary Ellen Kirkolos and Rachel Wyan are asking, could any of the COVID legislation coming up address the appalling conditions and abuses being meted out in New Bedford by Sheriff Hodgson on those inmates? They're suffering human rights abuses. And then Rachel says, can the state legislature pass legislation to protect our public? No, I'm sorry, I'm reading her wrong one, excuse me. She asked two questions. Can the state legislature pass a bill quickly to release detainees in the ICE detention centers, especially with the COVID-19 numbers? Situation in Bristol is totally unacceptable, must be corrected immediately.
So maybe we should break those up a little bit. The one pertaining to, releasing detainees, is that something that, Lindsay, maybe you could, is that anything that you have covered in your bill, or would you like to talk about that?
I mean, I can talk about it briefly. So releasing detainees from ICE custody is not something that is addressed in the legislation.
Yeah.
And it's not addressed in the legislation because it's not something that the state itself has control over. We reached out on multiple times and talked to different advocacy groups that helped with the legislation, and there was no way to include that. I imagine that Senator Eldridge will want to say a few things about this too, but I do think that in response to what's happened in Bristol County, there are many things that we can do. We don't necessarily have jurisdiction to release people, although there is a lawsuit through which many people have been released. I think the number I read today was 48. The sheriff is being sued over the inhumane conditions within the facility. But I will say he, by all accounts, yesterday refused to allow a legislator to enter the jail, which is in violation of Massachusetts law. He claims otherwise, but it's both general law and protected within the Constitution, which he, I believe, swore to uphold. So there is action that the legislature can take, and I imagine that we'll be discussing that in the next few days. I know personally I've been thinking of many things and have been on the phone with attorneys today to see where our authority lies. Some of it would lie with the House to start, but I think that's an ongoing conversation.
I see a question. I'm going to go with the first question here, Cole, if that's okay, from Rosemary. And the question is, are resources being focused on communities of color, low-income communities, prisons, and nursing homes? And so I think, honestly, any of you and all of you could answer that, because I'm sure you all have kind of been addressing that question. So whoever would like to start, and we can get through everyone.
Sure, I can talk a little bit about nursing homes. Is that in response to a lot of legislators being concerned about so many nursing homes being COVID-19 hotspots, including in my District 1 in the town of Littleton, where so far 10 residents have died and 1 nurse has died, is Governor Baker did provide, I think, around $130 million to nursing homes, hopefully to increase their staff. I personally think the nursing issue, beyond sort of Governor Baker not taking stronger action earlier, to Mike Connolly's point, it really highlights the broken healthcare system we have, and the need for, Medicare for all healthcare as a right system, because so many of these nursing homes are owned by national companies out of state. So that's what's happened on the nursing home front. I'll let my colleagues talk about the other issues, other than to say, I represent one city, the city of Marlborough, which is a very diverse city in Metro West. The two communities that have the highest coronavirus outbreaks or positive cases are Framingham and Marlborough, which have large Latino populations and a fairly high poverty rate. So I think it's really showing, how much the coronavirus has exposed, as some of my colleagues have already said, the injustices that are already happening. And I think it's a big test for the legislature. Are we going to respond, or are we just going to act like the status quo is fine?
Yeah, and so three of the key areas where the legislature has been engaged directly in addressing racial disparities, none of which, and collectively, are not enough. But one is just getting the data on understanding what the racial disparity is. So Massachusetts was not doing that, and many of our municipalities were not collecting the data on racial disparity and contraction of COVID and testing and deaths. And so letters were written, the Black and Latino Caucus, Boston Electeds of Color, Progressive Caucus, and many, many others, including advocates across the state, were pressing in. And I think the administration was receptive to that. We always have questions about how quickly or slowly the administration reacts, but they did immediately agree and have started collecting some of that data and publishing it at the municipal level. That is happening in some places. I know that Boston is one of them. I think Brookline, which is, I've got a piece of that in my district, are also doing that. I would love to see more neighborhood-based data, and I know many have asked for that, not just in my district, but in districts across the state. I think when you're looking at racial disparity, it's important to be able to look at the micro level and to see where, because it intersects very much with poverty, of course, and it intersects very much with immigration status, and a number of other factors that are demographic and that are often tied to the very local neighborhood level. And so being able to see that and address it in that way is important. So that's the next place in data. The second area is the crisis standards of care, which before we were flattening the curve, which is not a guaranteed long-term thing, but before we flattened it, we didn't know if we were going to be able to do it at all. And so the crisis standards of care are the standards for, well, I'm not a medical professional, and I'm not a healthcare professional, even compared to some of the people here. So I'm just going to say it in layman's terms, how I've come to understand when you have an overburden of the healthcare system and you have to decide we don't have enough life-saving equipment, we don't have enough life-saving capacity, who's going to get that care? Who's going to get that crisis care? So it's more complicated than that, but that's the crux of it. And those initial recommendations that were put forward, many or most people agreed were blind to racial injustice and inequities in ways that were very dangerous and were likely to result in people of color, especially Black people, being disproportionately denied life-saving care. And there are some complexities around there, but the short of it is, A, we don't think we're going to have to use our crisis standards of care because we have been able to flatten the curve. But B, there was sort of receptivity. The standards of care are recommendations, and John Santiago, who's a medical professional, emergency room doctor, most of you know, as well as a legislator, was bringing the updates to the Boston Electeds of Color and the Black and Latino Caucus, and I believe the COVID task force, of which he's a part of, in terms of what medical care providers of color were suggesting for the crisis standards of care, and some of those changes were made, at least to his satisfaction. I know at a Boston City Council hearing, people were still concerned that they had not gone far enough. So there is more work to do there, and we will need those crisis standards of care at some point in the future. And so The urgency of it feels a little bit less because we have flattened the curve and may not need to use those, because we do expect to have enough life-saving equipment for everyone who needs it. The third thing is really a need that is ongoing, and that is targeting, and someone in the chat mentioned this question as well, targeting resources for testing and for care, but especially for testing and contact tracing and for PPE and equipment to neighborhoods of color. And one place where I know Senator Nick Collins and Rep. Russell Holmes have began conversations with the governor is around our public housing network and our elder housing around the state, because we can't focus only in nursing homes or even only in assisted living facilities. There are many places where elders live and congregate that are equally vulnerable and don't have the kind of resources or care that you would have in those professional facilities because they're independent living residents, but are still equally at risk. And so there, and then in low-income communities of color, we need to make sure that the mobile testing sites are hitting there, that the National Guard resources are being targeted there. I know that in our city, they're using a data-driven model. I've spoken with our Chief of Health and Human Services about this a number of times to really figure out which neighborhoods are having the highest rates of infection and pushing new mobile testing sites, which are coming online this week, into those neighborhoods and trying to get them in or as close to public housing as possible. But that really needs to be a policy across the board for our entire state. None of this addresses the structural problems that we've made reference to here. These are sort of like putting out fire kinds of elements. So it's not really addressing racial disparity as much as acknowledging its existence and then responding to the fact of its existence. In order to address racial disparity, we need the things my colleagues have referenced here. We need healthcare for all. We need adequate housing for everyone. We need a generally just system and a safety net that's working for every resident, regardless of your documentation, regardless of your incarceration status. And without that type of justice, we're going to be constantly putting out fires every time there's an emergency.
Nika, before we move on, what are the obstacles to those kinds of policies, those policies that really will address the structural inequality? And what do you face in the legislature? And what is the issue with really, I mean, how come it's not more, how come we can't get more support for these things?
There are many valid responses to this that I would agree with. I'm going to focus on one element of it, which is to move things in the legislature, the legislators need to feel that their constituents are demanding it. And we don't have constituents demanding racial equity in every district or even the majority of districts across Massachusetts. If the people who were knocking on doors and making donations to political campaigns were demanding racial equity, you would see a sea change. People would be asking for that. And so a lot of our current progressive organizing is trying to shift, I've noticed and been part of also, but I've noticed many people making a shift away from the sort of, I don't mean to say this in a pejorative way, but like preaching to the choir, and to shift into making sure that we're communicating in language that other districts can understand. And not just using traditional progressive or leftist talking points. I think that even though we call it left and we call it, and progressive is associated with left, what we're talking about isn't really political. When we're talking about housing for all, healthcare for all, when we're talking about justice and opportunity for all, equal opportunities in employment and entrepreneurial, et cetera, these are not political points. And we have to continue to lead the way in shifting away from making these sort of political punching bags and attacking points and really educating our residents in every district. So if you have a statewide organization, don't just focus on the progressive places where people are going to immediately get behind you. Go do that teaching work. Find the legislators that maybe aren't totally with us, but maybe their heart is sort of open. We have to start moving into that next level of advocacy where we're shifting the hearts and minds of folks. There are a lot of legislators that would, if you just talk to them one-on-one, they agree. But if they don't have 5 or 10 people calling them every couple of weeks, saying, I'm really concerned that you're not doing enough for racial equity, and here are the things that I've heard should be done, they're not going to care. And frankly, a lot of residents don't care. They don't feel it. And so with the high profileness of the racial disparities and the immigration injustices that are, being revealed and pressed upon here in the COVID crisis, we have an opportunity to share stories that really cut straight to people's heart, and it's not judging them for having racist sort of tendencies or beliefs, knowingly or unknowingly. It's really just providing a pathway for them to understand the stories and move away to a better conception of justice.
Thank you very much. I'm looking at the questions. I don't want to miss anybody's question. There is something here from Rachel. Can the legislature pass legislation to protect our public health? For example, in the case of stopping the construction of the Weymouth compressor station, something the governor continues to say his hands are tied on after he made it possible by getting the permits passed by the DEP and the DPH. So I guess it's really a larger question about public health in general than the specific example of Weymouth. But as someone had said earlier, we're seeing much more vulnerability in areas where the air is polluted and the asthma rates are higher from things like a compressor station, et cetera. So if anyone wants to take that question.
Yeah, so thanks, Andrea. So great question. I don't know if anyone saw, I think Yvonne Abraham over the weekend or Friday wrote a great column on environmental justice. Specific to the question, I think it would be difficult for us to pass legislation to stop the Weymouth compressor station, just because unfortunately the permits have been approved and Baker administration supports it. But it raises the point that the reason that the Baker administration was able to approve that and get the fossil fuel gas station approved is because we don't have a strong environmental justice law in Massachusetts that requires more hearings and also an analysis that if it's going to disproportionately impact poor communities or communities of color, it would be harder for the project to get developed. So this is sort of a systemic issue that I hope this leads to more advocacy to pass the bill. I'm skeptical we could pass anything to stop that right now, but it raises hopefully the need for more advocacy on this issue to pass the legislation, which has been reported favorably at a committee.
Thank you. Does anyone else want to address that question?
I'd like to add something, but it's in a slightly different direction. I think right now, more than ever, the public is realizing the relationship between the legislature and the executive branch and the things that the executive branch can do and the things that the legislature can do. And I think that the executive and the legislature are working together more, at least I feel like my office is working more with the executive than we have in the past. But there are, it's the environmental justice component, but then there are also regional equity components. And since I'm the only person from outside of 495, I just wanted to highlight that. So right now, for example, they are talking about closing the only behavioral health beds and child psychiatric beds in all 4 counties of Western Massachusetts in Holyoke. It would also close a methadone clinic that serves about 600 people. And they decided to do that in the middle of COVID. So those people would have absolutely nowhere to go. And the response that we're getting is, well, they can go to Boston or they can go to Hartford or all of these places that are not Western Massachusetts and are not community based. So I just, when I heard the words public health, wanted to say there's so much we could do to protect the health and public health across the state in really meaningful ways, both not only through legislation, but through executive branch action, because DPH right now could be saying, no, we're very sorry. We're not closing behavioral health organizations at this moment. And that's not what they're saying to us, despite the fact that the federal government has just talked about, I think it's an $80 billion plan to try to fund BHOs. So we have to push on all fronts and in all ways. And we have fought for years to prevent a biomass plant going into Springfield, which has the highest asthma rates, I think second highest in the country. So yes, like these fights need to keep happening, and they need to keep happening on a daily basis. And I realize for folks how exhausting that can be, because it feels like you're just trying to keep plugging holes in dams, but they're totally worthwhile, and we need to push.
Thank you so much.
Here's a question from Heather Hoffman. How do we deal with the devaluation of the lives of the people who are most at risk for getting sick and possibly dying? I have friends who harp on the greater fatality levels in nursing homes, and despite their claims to be pro-life, dismiss these lives as being worth little, certainly less than their intense need to go to bars. Outside of their finding out that they are in fact at risk, how do we convince them that this is serious?
Well, Heather's my constituent, so I guess I should take the first stab at this very challenging question, because I think, it speaks to what we're up against. I mean, when COVID hit, there's a certain logic to COVID-19. You understand what we're facing. And once you figure out what we're facing, what you realize is every problem that folks like us would get together and talk about, whether it's housing justice, racial justice, climate justice, immigrant justice, transportation justice, each and every one of these problems has to be solved basically immediately to save lives. And that's so very difficult to do. And so I think to answer the question, we have to change our politics entirely. I mean, how Governor Baker is the most popular governor in the United States is, beyond me. And we could go through the long list of failures that we've seen from the executive in state government. I was thinking about how, Jamie mentioned systemic, the need for systemic change and addressing these environmental concerns. And it made me think about the Green Line Extension project in my district. This is a project that was mandated as a result of the Clean Air Act around the year 1990. And we broke ground on this in 2018, and we're expecting the project to be done in about a year and a half or so. And you think about that, it can't take 30 years to do a project that's a mandate under the Clean Air Act. And why does it take 30 years? It's because, anytime we've been in these conversations, I always mention this word austerity. It's because we are in an ongoing program of austerity in our state. And the time to deal with that ideally would have been before COVID-19, because we know now when we say we need new revenue, we're going to be told, well, our economy's in a free fall, so it's going to be hard to get new revenue. But austerity is all around us, and that's why people are dying. At these nursing homes, people are making minimum wage, and they're charged with trying to protect the lives of vulnerable individuals, and we're saying that they're worth minimum wage. It just speaks to so many different problems on so many different directions. And I think our only hope is that we can get through this and then see a transformation. I don't think change always occurs in a linear fashion. What we're going to need is a rapid transformation coming out of this, in the same way that the New Deal came following the Great Depression.
Great,
That's
thanks.
extremely hopeful.
And here's one from Vicky Zinn. Massachusetts has aggressive Medicaid estate recovery practices, under which many working class families are forced to sell their home upon the death of a family member to pay medical debt. They're working class virtually by definition because they're Medicaid eligible, and most of the recovery comes in the forms of people's homes. It seems like a lot more people will be exposed to this, both as a result of infection and death rates, and increasing reliance on mass health due to the economic crisis. Governor Baker tried to make this practice even more aggressive in 2017, but thankfully failed. Are there any conversations about scaling it back? are there concerns about him trying to expand it again to balance the budget? Not sure who wants to take that one, but
I can talk about that a tiny bit because I've had constituents reach out around the issue, which is part federal and part state. So the federal government gives us the authority to do the clawbacks, but does not specifically require us to do the clawbacks. So there's potential for us to change the way we do that. I will say, not that it's helpful, but when I've talked to different agencies about these, they say, well, you don't have to sell your home immediately. We'll just put a lien on it. And so if you sell it 20 or 30 years from now, you will owe us whatever amount that we say you owe. And then, of course, penalties and interest and things accrue. But there is that, they consider that a little bit of relief. I do know, though, that there is talk about filing legislation around this, at least the portion that we can handle on the state level. I know because I've been talking for a while about doing it, and I know that other legislators are as well, and we're kind of trying to combine efforts. But it is one of those things that we will see happen more frequently, and it's, again, another one of those cracks that is going to become clearer and larger to the general population.
great, thanks, Lindsay. Here's one from David Goodman. He didn't even come on the call. He submitted this question, but I like this question, so I'm going to ask it anyway. To what extent has the pandemic caused political enemies to rally together in common cause and scramble political alignments? For example, small property owners versus housing rights activists, pro-business interests and pro-workers, industrialists and environmentalists, pro-choice and anti-abortion, and Democrats versus Republicans.
Well, I don't want to monopolize all the time. I'll just briefly say that on the Small Property Owners Association, unfortunately, we have seen continued resistance to our eviction and foreclosure moratorium, which frankly, I've found to be unbelievable. And even after both branches passed a good bill, it was reported in State House News that the Greater Boston Real Estate Board was actively lobbying our governor to send that bill back to the legislature. So on that front, we haven't come together as much as I would have hoped. But I had seen Senator Eldridge was about to speak as well. So
Yeah, I would just say, I don't, sort of echo what Mike just said. I don't think you've seen a lot of political alliances, cross typical lines. So I mean, I think the corporate interests continue to push back, and just to give an example of a frustration of mine, not that it's a corporate interest, but one of our colleagues has filed a bill to provide hazard pay or sick pay for police, fire, EMS, first responders. So these are municipal officials, and very frustratingly, the Mass Municipal Association has pushed back on the bill. And as far as I can tell, that's why the legislature hasn't taken up the bill, because they're worried about the costs for cities and towns. Now, I recognize there might be some more costs for cities and towns, but my goodness, we're not going to provide support to our first responders right now. And if the state, would raise revenue, we could provide more support to cities and towns. So I would say the area where I've seen more collaboration is, I think that you're seeing more middle-class families that typically, might not have engaged around food insecurity or, mortgage forbearance. And suddenly they're saying, geez, I might have unemployment, but that's usually about half of my salary. How am I going to pay my bills? And maybe I should be advocating for policies, whether it's Medicare for all, universal basic income, or just a recognition that we're all in this together. And if, the prison down the street is a hot spot, or a nursing home or a hospital gets shut down, that's going to affect all of us. And hopefully that'll create more unity there to put over the top some of these bills that many of us have filed.
I would echo what Jamie said with regards to areas where the middle class is feeling the pain, such as food insecurity. in the building, there has been, my tenure is a year and change. So in my tenure, unprecedented, I don't know what happened before I got there, coming together by legislators around issues of food security and making sure that even the people in the most deep poverty have access to things like online grocery delivery. I think over 70 legislators signed on in just less than 2 business days to some letters to our congressional delegation and to the resolution regarding that type of thing, and housing as well. Also commercial, sort of racial disparities within commercial, entrepreneurialism, so small businesses, commercial evictions, but also extending into people noticing that the support that comes from the federal government has disproportionately gone to larger and wider owned businesses. So places where like everyday people are really feeling that pain. Part of the challenge with that is that wherever there's an ancient or older ism like racism, or the way that people, I know that how I don't even know what to call the viewpoints that people have of incarcerated people, because it does intersect with racism, but it's older than that. Our view of criminalness and what that looks like, our views of immigrants. So these things that are more deeply rooted and more deeply politicized, I think there continues to be that glacial response to even the very strong legislation that's been written. I can't speak so much to what's happening outside of the building, if there's any shifting there, but I think inside of the building, people are certainly more reticent about anything that's crossing over with race, immigration, or incarceration.
Thank you so much, Nika. So we are getting close to the end of this hour. And so I would love to get a couple of closing statements from the 4 of you. And I just wanted to read one question, and maybe you could, in responding, think of this question in terms of your response. It's from Masade. If there were enough testing kits to test everyone, let's say every other week, not everyone had to be locked down, but only sick people had to stay home, it would have been cheaper than billions and billions of dollars that have been given to airlines and other industries. She would like to hear you comment on that. This, idea of these of more testing, and really this prevention, and how that would really have been a much more effective response that would have been saved money in the long term. So just this idea of, because our whole purpose here is really to talk about the funding of healthcare, of the well-being and the welfare of the public, as opposed to the way that we're spending money now, the priorities that are so incredibly out of whack. How do we really get to that more transformational kind of politics that Mike was talking about, that all of you embrace? How do we do that? How do we get Massachusetts residents to really come on board with a radical prioritization of our values, of our policies, and really talking about prevention as opposed to always responding, always just throwing money at things, and not really ever being really prepared in the deepest and most holistic sense of the word. There was one other question that we can send to, but I think everybody else has been answered. But if you would just all take a couple of minutes as to really what gives you hope, how do we get to that more transformational place with our politics, so that we are a stronger, more resilient state and people.
So I was going to say, Andrea, thanks for the softball question. Nice and easy. I also want to say all my colleagues have much better backgrounds than me, so I got to work on my Zoom background. It's kind of embarrassing. So good job, guys. I think what gives me hope is that, and Nika just talked about it, is that, I do think people that traditionally have felt that, they didn't need help from the government, or somehow that they didn't already get support from the government, are realizing that they do, or they do need it. So I think it's an opportunity to have, conversations with people that are sort of on the fence. And I think that is so important, because I certainly hope that we pass, legislation similar to Mike Connolly's, foreclosure eviction moratorium bill, sort of comprehensive bills. But, so far there hasn't been a lot of movement on these bills. And I'm hoping that happens, during this period. But I think it's also an opportunity to have conversations with, more people in the middle that are now impacted and saying, geez, I'm frustrated that the community hospital down the street shut down the ICU, or that the nursing home, was understaffed, or, DPH wasn't involved soon enough with oversight, or even just that, these hotspots are affecting entire communities, and therefore, I should look out to my neighbor who might be, less well off. So that certainly gives me a lot of hope, but I do think, there needs to be a lot of organizing. I will say that, beginning this past week, I've started doing phone banks for candidates running for the legislature in open seats, because I think that, we need to elect more progressives to public office. And I think people I found are comfortable to work on campaigns now. When I'm calling, voters, they're not offended that I've called them. So I think it's an opportunity to get out there and get more people elected, and really just make the point that we can all make a difference in this pandemic and create that systemic change for the future as well.
Thank you very much. Who would like to go next? Anything you want to share? Mike?
All right, I guess I'll go because no one else is going. Well, thank you for having me. This has really been a rejuvenating sort of conversation to bring us all together and talk about all the work we're doing. In terms of, hope, I think, Jamie makes a good point. The legislature is getting more progressive. It's been so incredible to have Nika and Lindsay and others join us this term. And I like to think that if we continue on that trajectory, then who knows next term how progressive the legislature may be. Another area that I think is important, and it could potentially give us hope, and I'm all for it, is I think we should stay in session longer than July 31st, which is the usual standard end of the 2-year session. One idea I floated and I've shared with a few people is maybe we come back in September and do a fall session and try to keep working on things, because obviously most of us have been, in our homes or our apartments for months now. And there's going to be a whole lot of work to do just to address COVID. And then there's all the other priorities that we were working on before COVID hit. One final point I'll mention, and it's not really a grand way to conclude, but it's just something I wanted to get out there and share with people, because again, it speaks to this disconnect that we have with Governor Baker. He announced this week, I'll put it up on the screen, maybe you can see it, maybe you can't, a reopening advisory board. He brought together a board of people who will advise him on the reopening. And what do you know? Not a single teacher is on this board, not a single representative of organized labor or, a frontline worker, not included on this board. Instead, it's, largely CEOs and those sorts of folks who will be advising on how we reopen. And again, I think this speaks to the disconnect that we've had where so many people are just not visible in our policy making. So I guess that isn't hopeful. That's the opposite of hopeful. But we're talking about it, and we're all going to keep talking about it until we make progress. So that gives me hope. And thanks for having me once again.
Thanks so much.
I would say the hope we have is the hope that we've always had. Not always, but the hope we've had all session. And that is that residents of Massachusetts are realizing that democracy is the responsibility of every resident. It is not the purview of politicians and elected officials alone. That their job, your job, everybody's job is to hold our democracy accountable, to learn and to elevate our understanding and our thinking about what needs to happen COVID is bringing even more people into that than probably even Donald Trump did, which was significant. And it's sad that it requires a crisis to really motivate us, but we have been provided those crises time after time over the last couple of years. And so the hope actually multiplies. People are becoming more generous, more open, and others aren't. But those who are. To just target back to the real specific question of testing. Yes, of course. Yeah, I think. Well, I can certainly speak for myself that hindsight 2020 and all that. If we focused, as some other countries did, even just as a state, in radical testing and provision of PPE, targeting, contact tracing, that was all known information before the outbreak got very serious in Massachusetts. That was known information in February. And there were nations that were taking that strategy as early as late January. And so that was within the realm of possibility, and certainly would have been a less expensive, maybe, certainly a more targeted way, as long as we made sure that was justly applied and equitably meted out. And so we are moving in that direction. I think the governor has really embraced this sort of testing, contract tracing model, but now it's kind of late. I mean, it's not too late to have a significant impact. We are flattening our curve. But it's not ingrained with social justice, racial justice, immigrant justice. It still has that anti-poor sentiment, just because all of our institutional responses to things have the anti-poor, anti-Black, anti-immigrant sentiment woven into them, so that you always are having to write letters and ask and request and make calls to say, hey, why didn't you include these groups? As Mike used the word, invisible. They're invisible to the people that are making the policy, and that is now us. So that's hopeful. And somebody in the chat did put the question about, well, I have a pre-existing condition, and I don't want to just go straight back to teaching at my community college and everything opens up. I think that's a very strong point, and we are looking at here, and I know Congresswoman Presley and Senator Markey have also shared with me, looking at a holistic understanding of recovery, and even what that means in terms of infrastructure development. And we do certainly want to include making sure that people are safe until we have a vaccine, who are at a higher risk for serious illness or death if they contract the illness. Those two questions, I think, are great to juxtapose in a conclusion, because the first question of shouldn't we have just really done massive testing, and it needed to come from federal, it didn't, and whatever. There are a lot of reasons why we didn't get there in Massachusetts quickly, but that sensibility about having a systemic response in the beginning, a systemic and a just response instead of a reactive response, as was said, instead of being reactionary to what comes at you, waiting, you have to be asked. That type of leadership has been a vacuum in Massachusetts for quite some time, maybe decades. And the other question looks to are we just trying to get through something and go back to the status quo? Or do we realize we need to really recreate our system so that they are just, so that the new normal isn't just a new normal where we're defended against a disease or a virus, but it's a new normal where we have a stronger safety net and where we filled in the cracks of those foundations. And that needs to be reflected in how we respond to COVID, and making sure that there are no gaps. And a lot of the legislation is progressive legislators and other legislators who aren't traditionally thought of as progressive but are worried about their constituents, filling in the gaps and finding those people who have been invisible in the federal legislation and in our state policies, and making sure we fill them in. But that's the mindset that we have to carry forward. Every single resident matters, whether they've been here for 30 seconds or their family's been in Massachusetts for 300 years, whether they're sick or healthy, whether they are poor or wealthy, whatever, all the different things. And we have to carry that mindset not only into how we talk about politics, but how we treat each other.
Thank you so much, Nika. Lindsay, no pressure, but you can take us out here.
No, after this, that's a lot of pressure. I was really glad that Nika took the question and talked about the contact tracing and the PPE too, because I I think one of the things that we forget sometimes with the testing is that if you are asymptomatic, those tests can come back as false negatives, which is really important, which is why the PPE and the contact tracing are so essential. And that should have been our first plan. With testing, again, I represent 5 communities in Western Massachusetts, and we didn't have drive-through testing for a really, really long time, or at least it felt like a really long time. And we had to fight really hard to just get drive-through testing for our first responders. I had a community where we had too many of the firefighters in quarantine because they couldn't get tested, that we had to reach out to DPH and say, you are decimating this fire force. They may not be able to do their jobs unless you actually get them real priority testing. But the small communities a lot of times get left out of these equations, and that can be truly devastating. So yes, in hindsight, there are a lot of things that we should have done, but what can we do now? So in terms of hope, I think that people need to really understand, first of all, what your state government does for you. And I say this a lot, but I think there's always a ton of attention to what happens on the federal level, and there's a ton of attention which happens on the municipal level, but we forget that it's a chain. And so federal budgets affect state budgets, which affect municipal budgets, and all of the issues flow up and down along that chain. And people need to understand what the legislature can do, which is different from the executive branch. So that, first of all, that level of education could be dramatic in figuring out that, yes, we can have Medicare for all on a state level. It doesn't have to just be a federal issue. We can do things around environmental justice in the state of Massachusetts. We don't have to wait for the federal government. That expectation should be raised for folks watching this, or everywhere. Everyone should have a better expectation of what our government can do. And for me, a real source of hope coming up, though, is our state budget. So we are going to enter a moment where people are going to talk about austerity. And Mike rightly pointed out, we have long had an austerity budget, but we don't have to do that moving into this. There's no reason for us to say we can't generate revenue right now. In fact, when we had the recession in 2008, we raised the sales tax. So there is precedent for that. And I'm not saying that that is the solution. There are solutions. So there are ways that really great minds, because Massachusetts is full of them, can come together and talk about a budget for our state that actually supports people and that taxes the wealthy. That is fundamental. I think we are in a hard position. We have to have a balanced budget. We have pushed all of the safety nets onto the states rather than the federal government, which can print money and doesn't need the balanced budget. But at the same time, we can flip what we're funding. And that's where we're going to need the advocacy from everyone, because we are going to need to hear from you. We want a budget that supports us. We want revenue generated that supports regular people, so that the next time there's a crisis, there's a safety net in place. We aren't going to worry about unemployment running out. We're not going to worry that people only have $12 in their bank account, or that they're going to get kicked off of healthcare, because we've already taken care of those things. And that's the preventative medicine we need to focus on in this next budget.
Fantastic. Thank you so much. Well, I want to thank everyone who joined us tonight, all of our fantastic legislators, and for all the work you do and your tireless dedication to the people of this state and this Commonwealth. And we wanted to bring your attention to the petition that we had mentioned earlier in the evening, as well as to support Representative Sabadosa's decarceration legislation as well. And we'll be sending an alert on that. We do these every Sunday night. No, I'm sorry, every two weeks on Sunday at 7. So please stay tuned, and we will send out information about the next events that we have. Thank you so much to everyone. Thank you to our panelists, and keep up your great work. And everyone, take good care. And thank you. We'll see you again soon.
Stay safe.
Bye. Thanks, Nika.
Bye.